Good morning, everybody. Thanks so much for having me. Again, I'm Melissa Stafford Jones. I'm the director of the Children and Youth Behavioral Health Initiative. I sit in the California Health and Human Services Agency, Cal-HHS. But as I hope to share with you today, this is really a multi-sector initiative at its sort of heart and soul of the work. So thanks for having me and the chance to talk about it. And really appreciate actually being able to speak at this exact moment, because following both Ken and Amanda, I was really grateful to hear both of their presentations and maybe have some opportunity to think together with you about how some of the different pieces of the work actually connect. Okay, so let's see if I can get to, oh, I'm assuming my slides come right next. Oh, here we go. Okay, great. So I want to do a couple of things today. I just want to tell you a little bit about the how of how we are thinking about the work of reimagining the ecosystem that supports behavioral health and social emotional well-being for California's children and youth. I want to just give a high-level summary of some of the key components of the initiative. I think of them as tools in our toolbox to advance that vision that comes from the reimagining, but it's not everything. There are so many other things happening in the field that you already have heard about over the last day and a half that are part of this work of creating the ecosystem we all want to support the well-being of our children and youth in the state. So I think of these as some of the tools, and I want to just share a little bit about them with you. And then I want to talk a little bit about, spend a minute or two just on how we are working with stakeholders, including children, youth, and families as part of the initiative, just so that you know how that work is happening, how you might plug into it, where you can get more information as the work together continues. I included this slide. You all know this data. I'm not going to spend time going through the data. We all know what is happening in terms of the crisis of mental health for our children and youth, and that this was a set of issues and trends that we were all extremely concerned about before the pandemic, and that we know they've been exacerbated by the pandemic, but that these are at least a 10-year set of issues where we have been seeing the trends in terms of the increasing challenges to the social, emotional well-being, the mental health, the behavioral health of our children and youth, not just in California, but across the country, and if you've seen some of the studies with the pandemic, actually across the world. And what I want to note about why I still included this data, even though I know you all know this, is over the last several months, as I've been talking with many partners and experts and stakeholders and youth and parents around the work of the initiative, folks have made it very clear that there's tremendous work happening, so much important work happening to address this, but it often feels to people like we're solving a series of problems and issues versus actually stepping back and doing some of the work you were hearing about this morning, which is, wait a minute, how do we actually organize ourselves as a system so maybe we don't even have some of these issues, or that when we do, we have a way of responding that is what we would all hope for, that we would have in terms of a much more holistic, humane, integrated, youth and family-centered approach. And I also include this slide because I think it's really important to recognize a lot of the work I'm going to talk about today that we're doing through the Children and Youth Behavioral Health Initiative is work that is over the next several years. It's starting now, but it's work we're going to be doing now, a year from now, 3 years from now, 5 years from now. We heard about collective impact earlier this morning. We know the collective impact literature tells us that most major systemic changes take 8 to 10 years. So we know this is longer term work, and yet we know our children and youth have needs right now. And this is very real for all of us. My husband is a public high school teacher, and he got home late last night because he had a student who attempted suicide, and they were meeting after school about how collectively they were going to support that family. So this is real for all of us. This work is right now. There are needs and issues right now. And yes, we are talking about work that's 2, 3, 5 years down the road. And yet, I was on the phone with a really thoughtful school district leader earlier this week, and I did pose the question of, what else could we be doing right now? Like, what are we not doing that we could be doing collectively right now while we also do this mid and longer term work? And the answer, from my perspective, was both really thoughtful but also really challenging, which was, Yes, there are some more things we could do, but what they really are trying to do in this particular district is just more quickly digging deeper to the systems level change work. Because there aren't a whole lot of great Band-Aids of short-term fixes right now. Doesn't mean there aren't any that we could do better at. Of course there are. There are always problems we could solve, do better than what we're doing today. But I think that's just a really challenging place for all of us collectively who care so much about this work and the children and youth and the families that we know are struggling, to sort of hold space for that there aren't any easy answers and that it's really, really challenging work, especially after the last couple of years when people are depleted, as we heard about from Ken. So I just want to hold space for that. Yes, let's keep doing everything we can do right now. I don't want you to think that as we're working on the Children and Youth Behavioral Health Initiative, and I'm going to talk a little bit about what we're doing to set 5-year outcomes goals, that we are have blinders on to what's happening today. That our effort is to really hold space for what's needed immediately, what's short and middle term, and what's longer term, all at the same time, and that we're hoping to do that collectively with all of you in this room and with all of the partners that are working together on this across the state. And I include this slide because I think you all know actually addressing the behavioral health of children and youth is very, very powerful in their lives long term. And that is part of what I think drives us all together to do this work, both for their learning, but really their life, for the life course. I just want to start with this slide. So let me spend just a couple of minutes giving you an overview of the Children and Youth Behavioral Health Initiative. And there's one slide in particular I want to spend actually the bulk of my presentation on. This slide I include, these are the guiding principles that drive all of the work of the California Health and Human Services Agency. And I include them here just to step back and pause and recognize that improving behavioral health of all Californians, taking a systemic approach, really looking at this issue holistically, recognizing all of the cross-sector and systems work and really the root cause work at the social determinants of health that needs to be done, is part of the commitment of the governor and of the Health and Human Services Agency guided by these principles. So the Children and Youth Behavioral Health Initiative is one component of a larger commitment and agenda around improving behavioral health of all Californians. So this is the slide I want to spend just a couple of minutes on about what is the Children and Youth Behavioral Health Initiative and how are we approaching it? Because I actually think that the how is incredibly important in addition to the what. So the first thing is it as you see on this slide, is it really is meant to be a reimagining. It is really meant to say, wait a minute, let's pause and not assume that all the work we're going to do together in the context of the initiative assumes that everything has to stay the way it is in terms of the different systems and how they work. This is our chance to actually maybe think about those things differently. So how do we do that? And a part of that is really the recognition of having a system that is centering children, youth, and families, that is equity focused, and that really thinks about how do we do more work earlier, more upstream, more from a prevention standpoint. And how we rethink about the ecosystem really means that we're saying this is a systems change initiative. I started in this role in November, and there have been a number of themes I've heard from partners over the last several months, but probably the biggest one has been what we heard about a little earlier this morning, which is, Melissa, if there's only one thing you do working on the Children and Youth Behavioral Health Initiative, you've got to bust up some of the silos that we have. They don't work. They don't work for our kids. I don't think they work for the people who work in the system. So like if there's anything we can do as part of this initiative to create change, to create systemic change, how do we address those silos? And I think it's incredibly frustrating for people because we all know these systems are full of dedicated, caring, compassionate, hardworking, giving, amazing human beings doing this work who feel incredibly frustrated at not having the outcomes that we want for our children and youth in terms of their well-being. And it really goes to the issue, it's so interesting, I hadn't thought of it as wiring, so I'm taking that in, Ken. Sometimes I think about it as the infrastructure or the architecture of the system we have, but I think then Ken's getting us to like that next level of really how do you operationalize? If we do this work of reimagining and we come up with a different sort of architecture and picture of what it is, how do we actually change the wiring so it functions that way over time? How do we get in and change it from the inside out? What does that look like? How do we do that? And what's clear, as you heard from Amanda's presentation, is there's already amazing work happening on the ground in this way. Partners who are already working together in deep collaboration, all kinds of bright spots and best practices that are there. And what I hear from folks is those bright spots and best practices, different kinds of collaborations, new ways of doing things that are occurring, they are very hard to make systemic. They are very hard to scale, and they're really hard to sustain because that infrastructure, architecture, and wiring does not support those things, making it systemic, scalable, and sustainable. So that is our opportunity and our very scary challenge of the Children and Youth Behavioral Health Initiative. How do we try to tackle that and change that and have a different conversation about what that could look like and how we would make the change to this reimagined ecosystem? And I would say, I think one of the most critical, like if we're going to make this change, which we're going to do together, the piece that is going to be the difference is truly and authentically centering not just the voice, but the strengths and the needs of the experiences of children, youth, and families themselves. As Amanda said, it changed their entire approach to their wellness center when they heard from their youth. Now, how do we do that statewide with all of this work? How do we listen in a way and partner and engage that actually allows those experiences to transform our approach and how we organize and support our systems? And so that is part of our commitment of the work of the Children and Youth Behavioral Health Initiative is to do that, is to have that deeply embedded in the work of the initiative, is the engagement of children, youth, and families in the work itself. A couple of other things I just want to note about the initiative overall. It is for all children and youth in California, ages 0 to 25. It very much intentionally takes, if you're familiar with the work of John Powell at the Othering and Belonging Institute at UC Berkeley, it takes a targeted universalism approach. We have this goal of well-being for all children and youth in California, and we recognize that some groups of our students and young people face more barriers, more systemic barriers, more historical barriers, like structural racism, like poverty, like long time under service and investment in different kinds of services, including behavioral health, that create greater barriers to wellness. And so we have to have strategies that address those differences while we hold this shared universal goal for all children and youth. And that is critical to our ability to really center equity, as is, I think, really centering the voice of children, youth, and families. That is going to be part of being more trauma-informed, but actually really creating a system that is more equitable. It also is intended to work across the entire continuum of services, all the way from the most upstream prevention, thinking about wellness and social determinants of health, to our children and youth that have the most complex and intensive needs. And not necessarily doing that all within the context of the Children and Youth Behavioral Health Initiative itself, because the last thing that I want to do and that we want to do at Cal HHS is have the Children and Youth Behavioral Health Initiative become another silo and have the 14 work streams that are part of it become 14 more silos. That is not what we are trying to accomplish. So, for example, there are already several tables set related to system of care, really thinking about how do we collectively and in a much more integrated way, both at the local and state level, serve our foster youth at highest risk. So we're not going to recreate a table for that group inside the Children and Youth Behavioral Health Initiative. We need to figure out how to bring the assets of the Children and Youth Behavioral Health Initiative to that work and to those tables. But it is intended to think about the entire continuum of care. And all of this takes deep, deep collaboration and partnership, as Amanda talked about. It is cross-sector, it is cross-generational, it is cross-system, it is state and local, it is every cross you can imagine is needed as part of this work with very deep collaboration and partnership. And in my mind, really doing that in such a way where we are allowing people to set a new table together, not where we all sort of sit at our current existing tables and maybe reach out and share a fork or a piece of bread. We actually come together and set a new table and create a new conversation together about what is this reimagined ecosystem and how are we going to make it real in practice in a way that is scalable and sustainable. And as part of that, I do want to be really clear that although the Children and Youth Behavioral Health Initiative is a state-level initiative, and I think from conversations with actually many of you in this room and others over the last several months, it's really important that we do articulate, well, what is this ecosystem? Sometimes people do look at me and say, Melissa, what are you talking about? Like, what is this reimagined ecosystem? What do you mean? We need to put that on paper. I call it a working paper with coffee stains. It's going to have a lot of stuff to still figure out. But we need to articulate at a state level. If we had this really amazing reimagined ecosystem that everybody in this room dreams of, that really supports the well-being and the behavioral health of our children and youth, what would it look like? What could it do? What capabilities would it have? What functionalities would it have? How might people work together? What outcomes would it get? What would be different than what we have today? But we also know it is not going to be organized and look the same across the state. It's going to look different in different localities. I don't know, maybe there's 4 models, 5 basic models, but it will look different in different places, and I think that's a good thing. That's an opportunity for learning, because we know we're not going to get all of this right from the start. We have to really dig in and take this as a learning approach, that we are figuring out how to make a better ecosystem together, not because there's one specific endpoint where we will be done, but that we're building an ecosystem that can continue to improve and learn and get better in terms of improving outcomes for children and youth. And so what you're hearing, I hope, is an approach of transformation, of systems change, of deep commitment to partnership and collaboration, really thinking about how to create a system that is much more oriented to wellness and prevention and early intervention and supports, and that really centers children, youth, and families in the work as part of creating a more equitable system. I only want to mention one thing on this slide because I've talked about almost everything on it here. I just want to note how important the issue that Amanda raised is of stigma that we have heard from all of our partners. And I'll note when I get to slide in just a moment, around the different components of the Children and Youth Behavioral Health Initiative, it does include 2 specific sort of public awareness campaigns that are meant to address stigma. I also want to note, though, something that's become very real for me in the work is actually addressing stigma has to run throughout everything we do in terms of the ecosystem. Every moment of how we structure the ecosystem is actually a moment to think about how we are addressing stigma as part of that, not just from an awareness and building understanding, but really sort of baked into the ecosystem itself. I've talked about most of these things. I just want to focus on the last bullet on this slide, and that is the Children and Youth Behavioral Health Initiative. It's a 5-year, $4.4 billion initiative. Much, not all, but much of the funding in the initiative is not ongoing funds. They are ongoing over the 5 years, but not necessarily beyond that. And so the initiative is really an opportunity to be a catalyst for this work. So how do we really maximize that role of being a catalyst for this conversation and work, and ultimately implementation together of this reimagined system? So we're in the work. We're in, moving into the second phase of the work after the last 6 months or so, really focusing on the first part of the work. I do want to note, though, as I mentioned a couple of minutes ago, we are working to set specific 5-year outcomes goals for the initiative. And we've been meeting with some groups with professional experience. We're working with some trusted local partners across the state to have children, youth, and parents with lived experience to inform what those specific goals should be. We've identified sort of 6 areas of outcomes, but are really looking to develop specific metrics that we will be measuring our progress by in the way of letting us know, are we on track? Are we headed in the right direction? What needs to continue to change? So these are the 4 buckets of the different work stream components that make up the Children and Youth Behavioral Health Initiative. As I mentioned, I think of them as tools in the toolbox to advance the work of creating this ecosystem, and that there are many other things going on beyond the Children and Youth Behavioral Health Initiative that are also a part of that work. Possibly, I don't know, we'll see. One of the things that might be the most valuable that we do in this first year of the Children and Youth Behavioral Health Initiative is we are right now working very hard on what we're calling a landscape analysis, which is sort of a high-level summary and picture of all of the major policy and systems change initiatives in education and health, and using it as a tool to bring folks together around in rooms like this and around tables to have the conversation around where are the opportunities for integration and coordination and systems thinking where we currently operate in silos. And how might we, as we're working on implementing today, right now, some of the current policy and systems changes that we're all working on, what are the opportunities to start building this reimagined ecosystem today through the work that's before us? So this slide, and by the way, this is all also on the Children and Youth Behavioral Health Initiative website. I think these slides will be shared, but if you go to our website, we also have all of this information on there. If you go in particular to a slide deck from a March 15th webinar we did. So you can see all of the different work streams we have here. There's a very intensive focus on building the behavioral health workforce that we need, because we know we do not have the workforce that we need. Really investing in the partnerships and the infrastructure and the relationships and the collaborative work that has not historically happened. How do we invest in that more fully to create that basic architecture for the ecosystem? How do we support that over time? A really important piece of this work is the development of a fee schedule for school-linked behavioral health services as part of both creating the infrastructure but also the sustainability, so that certain school-linked behavioral health services will be paid for, whether it's an all-payer fee schedule, so it will apply to both the Medi-Cal program as well as commercial insurance. So that will be a really important way of both increasing access to services, availability of services, but also sustainability. And I mentioned those 2 public awareness campaigns that you see on the right-hand side of the slide. This just gives you a little summary. I know you can't read this here, but I wanted you to just have it for reference in terms of sort of a brief 1-sentence overview of each of the work streams. And these are our high-level 5-year milestones. We're starting to work on really the next level of detail around each of the components of the work streams and what are some of the key next steps that will be happening on them. So for example, one of the work streams here is the Department of Healthcare Services, and each of these work streams are led by a specific department within the agency. So they each are led by a department, by a team who's working to implement them. So one of the things that's happening right now is the beginning of the development of the School Partnership Capacity and Infrastructure Grant Program. And listening to the conversations earlier today and to hearing what Ken was talking about, like that is a program that will be a grant program. It's going to be shaped, but how do we think about the shaping of it so it becomes an opportunity for rewiring? Not just, oh, we have, something that's good and we just want to make it bigger. Maybe there's some of that, but where are the opportunities to actually support that rewiring so we can start to really embed that in the ecosystem? And then I know I'm out of time, so I just want to note here, we really are very committed to deep stakeholder engagement. So we did a kickoff webinar in mid-March. If you want to spend 2 hours watching that, it's on our website. The slides are there too. But now there's stakeholder engagement happening across a range of aspects of the initiative. So at the initiative level overall, as I mentioned, we're doing a lot of stakeholder engagement around defining what the 5-year outcomes goals should be. We're also planning to stand up an overarching working group for the initiative, one that relates to equity and one that relates to prevention and wellness. So those don't exist yet. They exist on paper. We're working to figure out the right structure for those. But the departments leading these various work streams are doing deeper stakeholder engagement. So the Department of Healthcare Services has stood up 2 think tanks related to 2 of the work streams. 3 of the departments are coming together to do coordinated stakeholder sessions around school-linked and school-based behavioral health services that are taking place over the next 90 days or so. I think there's 25, don't quote me on that, I can't remember the exact number, but listening sessions that are happening in the next 60 to 90 days or so. So a lot of work happening around stakeholder engagement. We are working on also moving beyond the boundaries of sort of what I call the Sacramento bubble out into communities over the summer. We're going to be doing a series of community engagement sessions around how do we come together to support behavioral health and really thinking about the reimagined ecosystem in communities across the state this summer. And then the last thing I just want to close with this is around this commitment to children, youth, parent, and family engagement as a central way in which we do the work of the initiative. We had the opportunity to interview, I think it was 16 or 17 organizations across the state, very diverse organizations working trusted in their own local communities, and ask their advice. How would we approach doing this if we wanted to do it in a meaningful, authentic way? And you won't be surprised to hear the first thing they said is, don't do it yourselves, state. You're not trusted, it's not safe, you're not going to get what you need. You need to work through local trusted partners. So that's what we're doing. We're doing that sort of in an ad hoc way right now through a series of partners, but we are working over the course of the remainder of the calendar year, to really build a network of children, youth, and family engagement partners that we will work with through the entirety of the initiative. Not just now in the early listening stages, but as we're planning, as we're testing, as we're implementing related to the evaluation. So really thinking about how we do that. And in the interest of time, I will not go through all of the many insights they shared with us, which were incredibly, incredibly powerful. But we are working to take those insights and lessons they gave us and really embed them in the work that we're doing. And then the last thing, I just included our website. And if at this email address, if you're not currently on our stakeholder mailing list and would like to get our updates, we do updates every 6 or 8 weeks or so. And we will be holding webinars every couple of months just to provide overall updates on the work of the initiative, but we will also include on our website links to the different departments and their stakeholder activities. So if you want to sign up to be on that mailing list, please do that, or feel free to check out our website. And thanks again for having me. Really appreciate it.